China couldn't contain it, and now it seems no nation is immune. With a deadly pathogen blanketing the four corners of the globe, a team of experts joins us to help make sense of the pandemic. I'm Imran Gupta, and today on The Newsmakers, we'll unpack everything there is to know about the coronavirus. As we slowly adapt to a world where we're no longer supposed to shake hands or gather in public places, a collective unease seems to hang in the air. Terms like social distancing and flattening the curve are on everyone's lips, while scenarios of how bad things could get are on everyone's minds. As fear and anxiety permeates, debates rage online about wearing masks and the best way to self-isolate, about how we physically separate ourselves from others, and at the same time come together to solve the crisis on a global level. It all feels like the plot of a blockbuster movie no one has written an ending for. And with that kind of uncertainty comes a need to understand the exact nature of the virus and the possible outcomes of a pandemic which, we're being told, has only just begun. On the show, we'll examine what we know, how it spreads, and even what it feels like to have it. But first, Natalie Perhonen brings us this report.
The novel coronavirus has spread to every continent except Antarctica. Health experts are still trying to get a better understanding of it and find a vaccine. Here's what we know so far. It's a new coronavirus, meaning it's from a group of viruses that can jump from animals to humans. This virus is called SARS-CoV-2. It causes the disease COVID-19. The World Health Organization believes the incubation period ranges from 1 to 14 days. Common signs of infection are a fever, dry cough, and breathing difficulties. At the moment, the data suggests 80% of infections are mild. That could include pneumonia, or you could show no symptoms at all. 15% are severe, with people needing oxygen, and 5% are critical, which means sufferers will need ventilation. The elderly and those with underlying medical conditions are more likely to become seriously ill. Many epidemiologists suggest the mortality rate of COVID-19 is around 1%. But there do appear to be differences when it comes to age and sex. Older people have a higher risk of dying, and men currently have a higher mortality rate than women. How is COVID-19 different than the flu? Both cause respiratory disease. Both can be transmitted by contact, droplets, and from surfaces. COVID-19 appears to have a higher mortality rate than influenza. But the flu spreads faster than COVID-19, and that, the WHO says, means the novel coronavirus can be contained. There are actions you can take to help prevent the spread of the virus. Regularly wash your hands with soap and water for at least 20 seconds. Cough and sneeze into your elbow, and avoid close contact with people displaying symptoms. We're also being encouraged to practice social distancing. That means keeping a safe distance between yourself and others and limiting social gatherings. Health experts are learning more about this virus every day. Right now, there is no specific antiviral treatment for COVID-19 and no vaccine. But scientists across the world are working on it. Natalie Perhonen, The Newsmakers.
Well, joining me now from New York is Dr. Salvatore Pardo. He's the Chair of Emergency Medicine at Long Island Jewish Valley Stream Hospital. From Inverness, Scotland is Andrew Easton. He's a Professor of Virology at the University of Warwick. And in Seattle, we have Elizabeth Schneider, who contracted and then recovered from COVID-19. It's really good to have you all on The Newsmakers. I have a lot of questions, a lot of simple questions, because we all need to understand this and understand it well. Let me start with you, Elizabeth. What was it like to have it?
Thank you, Imran. It's great to be here. To be honest, I felt like I had the flu. A lot of the things that were discussed in the opening segment just now talked about how the symptoms of COVID-19 are very similar to what people experience when they have the flu. And honestly, until I got to the point where I was tested, I would have never thought that I had the coronavirus. I had a fever that spiked to 103 degrees Fahrenheit, 39 Celsius the first night. I had body aches, I had fatigue, I had a little bit of congestion, runny nose and post-nasal drip. I did have some nausea one evening. But other than that, I was thankfully, because I'm younger and I don't have any underlying health conditions, I was able to recover from home just taking over-the-counter medications, and I actually did not go to the doctor.
Elizabeth, as far as I understand, you were lucky to get tested. It's not as if you felt these symptoms and thought, oh, I need to get tested for corona. You just stumbled upon it by luck, right? Explain that process to us.
Yes, that's correct. So, as I mentioned, I did not think I had the coronavirus. I thought it was a flu. It was only until a couple days after I started feeling sick that I happened to stumble upon a Facebook post of a friend of mine, and she expressed that she was also sick and had very similar symptoms to myself and had fallen sick on the exact same day. Several people who were also my friends commented on her post saying, "Oh my gosh, I'm also sick. I have same similar symptoms." We all fell ill on the exact same day. It happened to be 3 days after a house party that all of us attended of about 30 to 35 people. So we kind of all banded together and commented on Facebook on this one post. Several people went to the doctor. They were tested negative for the flu, were told to just stay home and recover from home. They were not tested for coronavirus. It wasn't until a few days after that that those of the folks who had gone to the doctor were frustrated they were not tested for coronavirus. And that's when we all came upon the Seattle flu study, a research study here in Seattle that throughout the onset of the coronavirus outbreak in Seattle started to test people's nasal swab samples for coronavirus. And myself and many of the other people from the party who were ill submitted samples in that way. And I ended up getting a call on Saturday, March 7th, that my sample tested positive. And as of a few days ago, I have confirmation from 7 other people from the party who all tested positive as well.
And I think, Elizabeth, something that's encouraging for everybody watching this is that you are among, I mean, you're one among, I don't know, 70,000 plus who have fully recovered. Before I move on to the other guests and bring them into the discussion, do you feel 100% well right now?
I do. Yeah. You know, it's quite early in the morning here in Seattle, and I woke up at 4 this morning to do another interview at 5 a.m. And I do feel normal. I feel myself. It's been almost 3 weeks since I, had the onset of symptoms. In the beginning, when I first recovered, I did feel just a little bit tired. So I didn't want to, jump to the gym and start, working out a sweat just yet. And I still have been practicing a bit of social distancing. I haven't been going to any major parties or events.
Right. Okay. Well, it's good to hear. Let me bring in Dr. Salvatore Pardo. You're tackling this on the ground in your hospital. And we also have the macro issue here where we've got, not only do we have states, but nations and the global community. Some are freaking out. Some are saying, don't freak out. Where are we right now? Should we be extremely worried, or have we possibly got this under control?
Well, I think right here in New York, we are worried. I think, as you know, the governor and the mayor of New York City, the governor of New York State have enacted measures to protect the public from themselves, actually, by restricting events, gatherings across the country. I think it's a smart move and needed. And I think Elizabeth's anecdote about how she was at a gathering and all 7 are COVID positive is a strong example of what can happen if we don't do social distancing. So I think right now in the United States, I think it's still early.
Right. Okay. And Andrew Easton,
to tell exactly what's happening.
Right. Andrew Easton, it brings me to my next question about the UK specifically. You're in Scotland. I mean, some Scots wouldn't like to be a part of the UK, but it's still a part of the UK, therefore privy to all of its laws. So the UK has a different view of this compared to many of the other countries. Their way of tackling it is not to shut down everything, and they're trying to get to a point of what they call herd immunity. Explain that to us, if you can, how that might tackle this virus, and whether you think this bold move might work or not.
Well, I think there has been a little bit of a misunderstanding about the herd immunity issue, and I'll come to that in a moment.
Sure.
Yeah. So the UK government's approach has been to have a series of phases of actions to modify or to control to some degree the spread of the virus and the impact the virus has in the community. So it started off by trying to contain the virus in the way that many other countries have done. It's clear that the virus is now spreading more generally in the community, as it sounds as though it's doing in the US from the story we just heard earlier. At that point, containment is less likely to be successful. It's not entirely impossible, but it's less likely. So it goes on, it's moving on to a phase of trying to mitigate the impact of the infection. And there will be a series of steps as we progress through these various phases, which almost certainly will include some of the things that we've heard about closing down large events and so on. In fact, we've already experienced some of that. In terms of, so the aim here is to spread out the time frame over which the population is going to be exposed to the virus. So the peak incidence is considerably lower than would otherwise be the case. And that way, the intention is that the health services will be able to cope with the demand that will be placed on them more easily because it will be spread out over a longer time frame. The comment about the herd immunity was an attempt at an explanation of one of the outcomes of this approach is that there will be an increasing number of the population infected and then recover, and so the number of immune people will increase. And if there's a large number of immune people in the population, the likelihood of transmission is reduced because the virus has to look harder to find someone they may infect. So that's
Right. Professor Easton, is there then still that very high likelihood, even though you might be immune, even though a 20-year-old might be immune, they might still go home and infect grandma and end up killing her?
Well, if they're immune, they won't be carrying the virus.
I see. Got it.
At that time. So the expectation is, and at the moment we don't have a great deal of scientific background to confirm that this is going to be the case, is that once you have had the infection, you will become immune to further infections. So had it once and then
But is that clear cut for somebody like Elizabeth? Do we know for sure whether she's immune now after she's had it?
We don't know for sure with this virus because it hasn't been tested adequately. But based on what we know about other similar viruses, that is a very, very high probability that for a period of time which should extend into years, we would hope there will be real immunity. In other words, you wouldn't get a repeat infection with the same coronavirus. If the virus changed, of course, then all bets are off.
Yeah, Elizabeth, you're nodding in agreement yet? Tell me why.
Yes, I am. So I'm not a professor, but I have a background in biotechnology and molecular biology. I have a PhD in bioengineering from the University of California, Berkeley, and all my research experience has been in molecular biology. And I've been getting that question a lot. And he is absolutely correct that if I have been infected with the virus, I have recovered. There are certain memory cells that retain memory of the viral antigens that are displayed to the body's immune system. And if I am infected again with the same virus, or even a virus that has a few mutations, but the mutations are not enough such that the viral proteins or the antigens that my immune system recognizes are wildly different, then yes, I would have immunity. But I would say there have been a few cases of reinfection. I just read an article, a scientific journal yesterday about it, and it's not really clear why this is happening. So I don't think we can say anything positively just yet.
Right. I read about a man in Japan. So I also don't know. And this is part of the mystery right now, right, Dr. Pardo? Governments have to do something. They have to do something drastic because people go and they look at these live updates and they see the numbers climbing. Italy took such a massive jump yesterday. Everybody was afraid. It was extraordinary, right? We've seen it previously with Iran and so on. So decision makers have to make big decisions, but we don't have all the information that we need. So what do you do in that process?
I think what we're doing right now is we're waiting for the tests to be available. I think personally, I would like to be able to test more people, and the fact is that we don't have that capability today. I think over time, over the next week or two, we're going to be able to do that, and we'll have a better picture of what's actually happening. In the meantime, I think it's really important that people really practice hand hygiene and self-isolation. The professor mentioned herd immunity, and that's going to be the end result of all of this. And the reality of once you become immune, that's not the same thing of being a host, right? So hosts will carry a live virus from person to person. When you're immune, you're not a host. You're just immune, and the virus cannot live inside you. Yeah. So I think social distancing and doing what we're doing is the right thing to do.
Right. So Andrew Easton, to circle back to that question that I asked you earlier on. So when you're a host, not immune, but you don't really have symptoms, but you're still carrying it, especially for young people, what's their responsibility right now? Because a lot of people are going out. They say, well, I'm not going to get sick. Come on, you know, this is just the government's trying to control me. I want to go out and have a good time. Tell me about their personal responsibility and their responsibility to the collective.
Well, I think quoting a former colleague, Graham Medley, the issue here is that we all have responsibility for this. The outcome of this virus spreading is in our hands, literally in some cases. And the only way that we can manage this situation is if everybody takes responsibility for themselves. The measures that we've just heard, the hand hygiene and social distancing and so on, are really important because they not only protect you from acquiring the infection, but they, at the same time, if you were infected, would protect others around about you. So it would be a socially responsible thing to do. It's a message that's not easy to get over sometimes, and you're right. There are some people will think that, well, if it's not going to affect me, then I don't need to worry about it. But the reality is that they are affecting other people, and there's a social responsibility here that really should be emphasised. For some people, this is going to be a major problem and potentially life-threatening. So we really do have to get that message over that it's not trivial. It may be less severe for a subset of the population, but for others, it could be extremely dangerous.
Dr. Salvatore Pardo, as the chair of emergency medicine at Long Island Jewish Valley Stream Hospital, you're chairing these meetings where you're making plans, right? You obviously have contingency plans. You're looking at worst-case scenarios. Give us some insight into that. What are you guys talking about? What are you planning for? What are you factoring in?
Well, right now what we're focusing on is protecting our staff and taking care of people that come to the emergency room. So anybody that comes in that is even remotely suspicious of having any kind of infection, a fever, a cough, they immediately get masks. Our staff are wearing masks 24/7 when they're in the building. So we're trying to protect our staff. We do things to minimize the chance of aerosolization of the virus, such as nebulizer treatments and things like that, which are treatments for respiratory distress, let's say in asthma. Those individuals are put into a private room, and people are gowning up appropriately when they go into the room to take care of those people. We're trying to isolate all individuals that are suspicious for COVID, and frankly, most people now, as they enter the hospital with a fever, we are suspicious they have COVID, because what we're finding is that we're doing the routine respiratory panel and virus panel, and they're coming up negative. So likely what we're seeing is a spread of the coronavirus in the community, and they're arriving to our hospitals. Most of the people are fine. They look like Elizabeth did when she said she just felt like she had the flu. Those people should not be coming to the hospital looking for care, because they will transmit that virus to people that are more susceptible to the virus, such as the elderly and people that are routinely going to the hospital for care.
Yeah, and this is great information to have. Elizabeth, a lot of people are in a conundrum because they feel these flu-ish symptoms, but it's difficult to get a test, if at all possible, right? I mean, it's just difficult. They're not readily available. Now, you can blame politicians. It varies from country to country. What do? They suspect they have COVID and they're at home feeling sick.
Yeah, it is a really tough situation. I mean, I've had my own friends, in fact, people that had direct contact with me after I went to this ill-fated party and before I showed symptoms, who are having all of the symptoms, but they don't have a fever and they're denied a test because, doctors are saying they don't have a fever. So I think in some situations, people in the healthcare industry are, becoming more aware of this, that, as Dr. Pardo said, some people, are just having a few of the symptoms, or some people just think that they have a cold. Some of the folks that I went to the party with who ended up testing positive, they just thought they had a cold. And in fact, the weekend after the party, a couple of those people went on a trip to Vegas. They basically just had a little bit of congestion in the sniffles. So, I think that one thing that will definitely help is at-home test kits. So that's something that I did with the Seattle flu study when I tested positive. And you've been showing on this segment in the background some videos of people being tested with a nasal swab. So that's what I did. It was a very simple at-home test kit. And I know here in Seattle, the Gates Foundation has donated $5 million, they just announced last week, to send at-home testing kits to all folks in Seattle. And these can be mailed back. So that's one way people can get tested. These drive-by testing centers are cropping up more and more. But as Dr. Pardo mentioned, we can't take care of everyone or necessarily have everyone get tested who thinks that they have these symptoms. So the best thing to do right now is if you are displaying any of these symptoms, whether or not ultimately it would turn out you had the coronavirus or you had a cold, please stay home. And, unless you have life-threatening symptoms, stay home, take over-the-counter medications, get a lot of rest, drink a lot of fluids. And, that's what we need to do.
Mm-hmm. Professor Easton, as people are at home, whether they're under sort of official quarantine or they're just practicing social distancing and trying to keep things together and not mix too much outside, they do a lot of Googling. They'll go and Google about the Spanish flu and find that 20 to 50 million people died in 1918, and this came in about 3 waves over a period of about 18 months. Can we expect multiple waves of this virus?
Well, in reality, we simply don't know, is the answer, I'm afraid. It's not a happy answer to give, but it's the situation we find ourselves in. This is a novel virus. We have no previous experience of it. We know what it has done in China over the past few months in the face of fairly stringent efforts to contain it, but that's all we can say. And at the moment, the only tool that we have is modeling by computer on how these sorts of infections spread, but we don't have the specific information for this virus to give really totally accurate predictions. So that's one of the issues about the herd immunity. The hope is that the immunity will be sufficient to stop subsequent waves, at least for some time. But it's quite possible this virus is really with us for the long term and may reappear in episodes in the future.
Right. Dr. Pardo, I'm not asking you this next question because your name is Salvatore, but the Italians are saying, don't do what we did. Be proactive. Don't be like we were a month ago or a few weeks ago. Are they right?
Time will tell, but I do think that they have something there. They have recently restricted travel and shut things down. Here in New York, where it's still in its infancy, we have acted. So I'm glad that we have. The more I think about it, the more I see that this is really part of the solution. If you don't give people options to travel or options to go out or options to congregate, that is the best thing you can do from a public safety standpoint. So, yeah, I agree. I think we don't want to be in the same boat as as Italy. I think we have evidence from
Right.
South Korea and Japan, how they've handled it, which they've relied on testing and knowledge, which we're not there yet. But I think in the coming weeks, we'll have a better idea.
Elizabeth, very finally from you, both as somebody who contracted and then survived the coronavirus, but also as a PhD in microbiology, what is the one thing that our viewers need to understand about this virus?
Yeah, so I would just reiterate all of the comments that we said earlier. I think in the beginning of the segment, you had something like 80% of people who are healthy and younger, and even people who are older but don't have any underlying health problems will probably experience something like a nasty cold or a mild to moderate flu. So I want to emphasize that, and that you may not have the cough or shortness of breath or respiratory problems. I did not exhibit any of those. So please, don't panic, stay calm. But, as Dr. Pardo and Dr. Easton recommended, this is a crucial time for us to contain this virus by practicing social distancing and self-isolation. So, see if you can take time off work, see if you can work remote, bust out all of the food delivery apps, pop up your favorite TV show on Netflix, try and play some solitaire or play some board games over an app with friends, and please do what you can to protect others in our community that are most vulnerable right now.
Yeah, it's a rare moment in human history. These are indeed extraordinary times, and it's been a privilege and a pleasure talking to all of you to get a better understanding. And I feel like as if I'm doing a public international service here in asking you the simple questions and getting the message out there. Salvatore Pardo, Elizabeth Schneider, and Andrew Easton, pleasure talking to you all on the Newsmakers. Thanks for joining us. And thank you for watching. We will see you next time.
Thanks for having me.